Hello, my name is Diane, and welcome to the New Old Nurse. Here at the New Old Nurse, we discuss becoming a nurse, working as a nurse, and surviving as a nurse. Today's topic is assisted living nursing. I have so many people who ask me questions about this because, first of all, they don't ever even think of it as a type of employment for a nurse. They don't even think that assisted living facilities have nurses. They think, well, those people are okay. What do they need a nurse for? But in most assisted living facilities, if not all of them, they will offer services to people who aren't able to provide them anymore for themselves. One time when I started working at a skilled nursing facility, the nurse who was training me said, well, what did you even do there? And I had to laugh because it was pretty much the same thing I was doing at a skilled nursing facility. I'm going to talk to you a little bit about the upsides of working for an assisted living and the downsides, and that'll kind of give you an idea about the sorts of things you have to do. First things first, in general, folks at assisted living facilities are going to be less sick than in other areas where you might be nursing. So if they have to be hospitalized or they have to have significant rehab, they're almost certainly not in an assisted living facility. Granted, there can be some exceptions to that, particularly for end-of-life care, where the facility is not going to kick somebody out when they're transitioning at the end of their life. They're most likely going to receive hospice services so they can stay within the facility where they've been living. But so you're dealing with less sick patients. That's not always a bad thing. You might think, well, why bother being a nurse for people who don't really need it? Well, they still need help. They still need your assistance. They still need your care. You're going to be administering medications to people, including things like insulin, including things like morphine if they're at end of life. That all happens at assisted living facilities these days. So if you think as a nurse you're going to have a med cart and be giving folks their meds and whatnot, you're still doing that at an ALF. You also might be doing basic wound care. Depends on the facility. Some don't allow that at all, but some do. And some do significant wound care if they have a nurse on staff. So if wound care is something that you're interested in learning, that's still possible to do at an ALF. In general, however, you are going to be learning or utilizing less what we call nursing skills at an ALF. You might still do injections, but you're most likely not going to start an IV. You may be checking to see if a catheter is draining properly or applying a stat lock for the tubing, but you're almost certainly not going to be inserting a catheter at an ALF. You may assist a nurse who comes in, and that's what I have done sometimes, to do something like change a catheter or administer IV medication. Because I'm a nurse, they sometimes ask me for their assistance, but it's most likely not going to be my responsibility. If people need constant chronic nursing care like that, they usually can't live at an ALF or they need outside nursing, skilled nursing to come in. So if you're a brand new nurse and you think, oh, I want to start an IV on my first day. Oh, I want to start 5 catheters this week so I get really good at it. An ALF is not the best place for you to be starting off. I have had friends who thought an ALF was the perfect place to start off because they felt like it enabled them to have time to just get comfortable with medication administration, assessing folks, getting to learn how to take care of people in general without the added stress of all of these other skills. So it depends on what you're looking for. If you're looking for, oh my gosh, I want to be with the sickest, most acute folks, not an ALF. If you think, well, I want to just see how nursing is, what I'm going to do when I give somebody their meds, if they have an allergic reaction, if I have to talk to their doctor, that you can still learn at an assisted living. One of the downsides of working in assisted living that you may face is that they don't pay as well. This is not certain. It just depends on the facility and the area that you're in. Some assisted livings pay fantastic, especially because you might be the only nurse on staff. Depending on the state, they may not require any more than one nurse be at the facility at any time. So if they need one nurse to be there, they're probably going to pay you pretty well because you're going to be not necessarily supervising the rest of the staff, but you're going to be the point person for questions or concerns, whether it's from the residents, other staff, or the families. Your pay scale can vary, but in general, top dollar for your nursing earning potential is not going to be gotten at an assisted living facility. One of the other concerns about working at this type of place is that like everywhere else, they are pressured to meet their budget demands. Sometimes they take people who really should not be living there as residents. So even though you might think to yourself, oh, I'm not going to have somebody with XYZ conditions because I'm in an ALF, oh, you might. And then the worst part is you don't really have the supporting staff or resources to take the best care of them. This is something to look out for. When you're interviewing for a job, ask them, how many folks here have catheters? How many folks here can't walk? These are things that usually the state is regulating, that they can only have so many of these residents. But if the facility is pushing the boundaries a little bit because they are worried about their census, that can be an issue for you as a nurse, because you're simply not going to have the number of folks around you who are going to help you if you have any questions, to have the supplies maybe that you need, or just maybe it's a skill you haven't learned yet and they're going to come to you and expect you to be able to do it. So definitely that is a concern working at a facility like this, and it's something you want to look out for before obtaining employment there. Now let's talk about the upsides of assisted living nursing. One of the best upsides, in my opinion, of working at an ALF is that they're just much nicer facilities. I've been in facilities that have huge roaring fireplaces, giant movie theaters, which you might think, well, what am I going to do in a giant movie theater? Staff meetings are in nice facilities like that, staff events, staff training. It's just nice to be in a nicer place. I know of a facility nearby that is on a lake. Imagine how nice it might be on your lunch break to be able to walk a path by this giant lake, how much that might do for your work well-being. So if your work environment, actual setting is not that big of a deal for you, you may not care that these facilities are oftentimes a lot nicer, but if your surroundings affect your general well-being, which they do for me, think about this type of nursing. It might be the best choice for you. Another upside of assisted living nursing is that it's overall, I would say, less stressful. I can remember being at a skilled nursing facility where every day it was new admissions, it was discharges, it was, did the meds come in? Somebody doesn't arrive till 7 o'clock at night and their pain medication isn't here, and now you're dealing with them and they're in excruciating pain and it's a mess. That sort of thing, not in that way, that sort of thing doesn't really happen in an ALF. Yes, there's definitely going to be long, terrible, stressful days and stressful situations. That's going to be in nursing in general, let's be honest. But overall, the potential for these like high stress situations are going to be lower at an ALF. You may thrive on the fast pace of not knowing who your next patient is going to be, what's going to be wrong with them, whether you're going to have the supplies and the resources to take care of them. You might think, this is awesome. I'm like the MacGyver of nursing. Did I just date myself by saying MacGyver? But you also may hate that and you want a little bit more stability. ALF nursing is probably for you. One of the things I most appreciate while working in ALF is really getting to know your residents. First of all, they live there. They're not going anywhere. You get to know them. In a rehab or a hospital setting or a doctor's office, sure, you might be able to get to know them, but the nature of those places is that it's going to be transient for most folks. A lot of folks are going to come and go. At an ALF, people are actually living there. It is their home. You get to know them, you get to know their families, you get to feel like you're serving people you really learn to care for. Again, not everybody likes this. I remember a nurse said to me one time, I want somebody for 12 hours and that's it. If that's you, you would not like this type of nursing. But if you think getting to know somebody and being their nurse for 5 years straight, if you stay at a particular location of employment, this could be a great career choice for you. I personally love it. I love getting to know the people I'm taking care of. It just feels like I can do a better job for them when I know what their past is, when I know how they like things, when I get to know their families and can explain what's going on or call and ask questions about what's going on at any time. I just feel like I'm able to be the best nurse I can be in a situation like that, in an environment like that. So what's a typical day like at an assisted living? Well, in my experience, it's just like any other day of nursing. It's exhausting and it's long. But it's going to involve things like administering medication, of course, pills, liquids, nasal sprays, all of the normal stuff you might administer to somebody, breathing treatments, There's going to be people on oxygen. There's going to be people with catheters. There's going to be people with wounds. I mean, all of the stuff you would see at maybe a skilled nursing facility, you're going to see there. Because guess where a lot of them go after you, as a skilled nursing facility nurse, discharge them? They're going back to their facility. And then if that's where I'm working, am getting them a day after you just had them. So a lot of the same things happen. When people say, well, what do you even do there? I do nursing. Yep, that's what I do there. And particularly if you're the only nurse at the facility, which that can often happen, you are the point person. So if you're not comfortable with getting questions or making decisions, don't go work there. Overall, in my career thus far, I would say I love every type of nursing I've done for different reasons. But the situations where I feel like I made the most difference really were at these facilities, these residential type facilities, because the people really learn to count on you. They learn to look for you if there's a problem. They ask you what your schedule is so they know when they're going to see you and when they can get answers from you or get encouragement from you. It really has been an extremely rewarding experience, one that I would have never considered until I experienced it for myself. So if you have any other questions for me about assisted living nursing, or if you have any comments about what you have experienced there or stories to tell for us to commiserate or laugh about, please comment down below. Until next time.